Good morning, America, and today our topic is going to be OCD, which is also known as obsessive compulsive disorder. To really get to understand what this disorder means, we've got to get to know the basics. First of all, what is obsessive compulsive disorder? OCD requires an official medical diagnosis by a doctor. They will send you to a psychiatrist to get the treatment that you need. Now, this treatment doesn't necessarily cure OCD. Actually, I don't think that there is a case known to have completely cured OCD. It only minimizes the symptoms, but a lot of people will have to take medication for the rest of their life so they can live their daily life. OCD becomes so overwhelming that they cannot go day to day without going insane. The symptoms are usually gradual and worsen throughout life. However, when does this begin? Is it more prominent in males or females? The prevalence rate states that there are more than 200,000 cases of OCD per year. It is more common in boys than girls. The onset is usually childhood. Now, for boys, it's usually ages 6 to 15. For girls, usually it doesn't start till around age 13 or higher. 1 in every 3 children will have at least symptoms or beginning signs of OCD. Now, where did OCD come from? Well, there are a few theories that are regarding OCD. According to the psychoanalytic theory, obsessions and compulsions reflect maladaptive responses to unresolved conflicts from early stages of psychological development. Now, what does that actually mean? With your obsessions and your compulsions, you have very quick anger responses. If anything is a certain way that you have it and it gets messed up, for example, when most people think of OCD, they think of straightening the pencils or the pens on a desktop. All the dark greens have to go together, all the light greens have to go together. Now, if I have my 2 dark green pens laying down and I have this one, my light green separated, okay, that's fine. But if you see, I have one that shows the top, one that shows the bottom. They will make it a point, to flip it to where it matches. So if they aren't able to fix it the way that they see fit, the way that it is in their mind, then they can sometimes lash out in anger. And a lot of times, you see in the TV shows that they display OCD obsessions and compulsions, they will act out on it in an aggressive behavior. Now, this psychoanalytic theory has been recognized for more than 300 years. Also, another theory was that the English writers from the 18th century to late 17th centuries attributed intrusive, blasphemous images to the work of Satan. They would think that if you had OCD and you started having your aggression start showing out because things weren't the way that you wanted it to be, they would think that you were demon possessed. And as stated earlier, there is treatment. So what kind of treatment would there be? Well, there is medicine. Usually to help lessen the symptoms, they use SSRI or an antidepressant. So there's also different therapies that can help that are used as the treatment, such as support groups, cognitive behavioral theory, and also systematic desensitization. So for example, one of the treatments may be the patient comes in and you obviously know that they have OCD and you have something lying on the desk that's very straight and one item that is turned. And you go in telling them to sit down, and of course that's going to be the first thing that they realize. Don't allow them to fix it. You will see them looking off to their left or to their right depending on which direction it's in to see if they move it. But if you see that they're moving it, you can't let them move it, and it will slowly desensitize them to the OCD. If a person is to have OCD, they are more than likely to experience symptoms. Some of these symptoms include agitation, compulsive behavior, hoarding, impulsivity, repetition of movements such as jiggling a door handle 1, 2, or 3 times. There's a lot of numbers that involve that. If they go and repeat themselves, usually there's an amount of number of times that they have to do. There's also usually a broken connection. Usually they don't have a ton of social interaction, so that intends to on the back. Some of them actually have food phobia, but the main symptom I would say would be the cleanliness obsession, making sure everything is clean. You know, they're big germaphobe, and usually that's one of the top symptoms that usually screw OCD. And that concludes our series on OCD.